JSS has been a very strong platform. It has given me a lot of opportunities.
We train the students not just only in the clinicals, but also on how to work in the laboratories.
Our teachers and faculty, everybody has been so supportive. I've never felt like a foreigner in this place.
Around 500 patients per day visit the JSS Dental College.
The research microscope has additional attachments like the phase contrast microscopy, dark field microscopy, fluorescent microscopy, and image analysis with camera attachments.
We are able to treat the patient at the lowest cost.
Have focused particularly a care for special children, of which JSS Smile is one of the focus areas.
We have a good number of collections in our library.
The environment of the hostel is really good and we feel secure here. Providing each and every day healthy and hygienic food for us.
Our university has provided us with many sports facilities and gymnastic facilities to maintain our fitness.
To be the best, choose the best. Choose JSS Dental College and Hospital and feel the difference.
JSS Dental College is one of the premier institutions looked for graduation and post-graduation by many students.
JSS Dental College and Hospital is a extremely wonderful facility for the students and also for the patients to get the best of the care.
The first international webinar on the topic dental autopsy during COVID-19 by Dr. Emilio, University of Turin, Italy. A very warm welcome. I would also like to invite and welcome the key people for today, Our guest of honor, Dr. B. Manjunath, the Registrar of the JSS Academy of Higher Education and Professor of Forensic Medicine, JSS Medical College and Hospital. The main speaker for today, Professor Emilio Nuzzolese, our principal of JSS Dental College and Hospital, Dr. S. Ravindra, and our host panelist, Dr. G.B. Aravind, Associate Professor, Department of Forensic Science, JSS Medical College and Hospital. I consider it a great honor to invite Dr. B. Manjunath, the Registrar of JSS AHER, Academy of Higher Education and Research. He's a leader, an administrator, an educator, a physician by profession, persistently working towards the goals, mission, and vision and the organizational structure of JSS. Say a few words and inaugurate today's session.
Thank you, Swati. A very good afternoon to one and all. Professor Emilio, it is a privilege to have you amongst us, and we are all very eager to hear to you. First of all, I would like to seek the blessings of His Holiness. Today is a very auspicious day for us. Today is the birth anniversary of our founder president. So because of Swamiji's vision, every institution in JSS was started. So today is a very, we are all privileged and to have you amongst us on this particular day particularly. So as this topic is very interesting, and I being a forensic person, we sometimes neglect or miss out many things in the oral autopsy area, because it can give so many things leading to identification, age, sex, race, even in the sometimes the cause of death also, the injury. So these areas which we need to build further, and this is a very interesting topic. I would like to, I think I just remember Dr. Swati also being called by one of the air crash accidents which happened. She was called to help out the administration there. So I think we look forward to a very interesting talk from Professor Emilio, and I think Dr. G.B. Aravind will lead us forward in a very positive manner. Once again, welcome to JSS, Professor Emilio, and we look forward to your talks. Thank you.
I now invite Dr. G.B. Aravind, a renowned resource person, associate professor, who has 26 years of experience in teaching and evaluation in the field of criminology and forensic science, to introduce today's topic and its importance. Over to you, sir.
Thank you, Swati. Thank you, sir. Good afternoon, everyone. Seeking the blessings of His Holiness, I'd like to begin with introducing this topic. Good morning, Professor Emilio Nuzzolese. It's a morning to you there, I suppose. Now, the problem with identification has always vexed the law enforcement authorities all over the world. Right from the beginning of the era, where say we are talking about the era of Edmond Locard, where he had this problem of identification. Alfonso Bertillon had brought in something called as portrait parley, which remains still till date to a little extent. Anthropometry has now become defunct. Since then, the fingerprints have taken over, and then that has ruled the domain. When we talk about fingerprints, it's more or less something of the primary mode of identification world over. As yet, say so many things have not taken up into any further extent beyond that. There have been some developments in fingerprints also. That is the use of radiology, edgeology, and poroscopy also. However, they have not sufficed in some areas wherever the victim's body has been unrecognizable. So therefore, the Interpol had thought of some other alternate means of DVI, that is disaster victims identification also in many circumstances. During this, while doing so, some of them have toyed with DNA, but there has to be a matchable DNA sample somewhere else, and the next of kin also. And one of the other modes of this has been dental autopsy, that is the odontological identification. In this, say we are in a particular level where we can estimate the age of the individual also, not just say one factor, that is identification, but the age of the individual also. And in many, to go ahead with this, the AFOHR, that is Association for Forensic Odontology and Human Rights, has now recently celebrated its 5th birthday. So a very happy birthday to you. And without wasting much of the time, I'll hand over to the main speaker because we are all very eager and anxious to listen to him. He's been a chairman, and say it's been spent 5 years, five fruitful years, as I could add. And also we are very fortunate because Emilio Nuzzolese comes from a university, that is University of Turin, where the name criminology was coined by Raphael Garofalo sometime in 1874, along with another person, eminent person called as Enrico Ferri, one of the criminologists. Later on, Lombroso took over, and Cesar Lombroso took over and formulated the Italian school. Let me not delve into that. Let us come back into identification. And over to Swati for further proceedings. Dr. Swati, over to you.
It's a great honor for me to introduce our presenter for today, Dr. Emilio Nuzzolese. He's the head of the Human Identification Laboratory, University of Turin, Italy. He's a researcher and professor in legal medicine in the same university. He's a member of the Interpol Forensic Odontology Sub-Working Group since 2010. And president of the Association of Forensic Odontology for Human Rights. I welcome you, sir, to take over the session.
I would like to thank the JSS Dental College, the JSS Academy of Higher Education Research for inviting me. I would like to thank Dr. Umareshwar for the invitation and for the moderation and for the patience that she had inviting me and writing to me mails. I would like to thank also Professor Aravind and Dr. Nagabusha for the presentation and for reminding to us the importance of my university. I feel very privileged and honored to be part of the academic staff of the Medical Legal Institute in the University of Turin. The topic of today's presentation is related to dental autopsy, during the pandemic, COVID-19. And I will entertain you with 1 hour lecture. Let me prepare the PowerPoint. Can I have your feedback, please? Do you see this picture?
Yes, we can see it, sir.
Okay, perfect. So first of all, I would like to do a disclosure, an important announcement, as we are doing several webinars, and these webinars are addressed to experts and to forensic scientists involved in the field. Nevertheless, we are going on social media and we are going also on YouTube. So I would like to highlight 2 points. First of all, an ethical clarifications. These presentations is related to human identification and is reserved to experts in forensics. There are some human remains pictures which are displayed strictly for the didactic purpose of this lecture. The anatomical areas that I am showing will be have been specifically cropped for the purpose of this webinar, because I am aware that this goes on social media. So please, no one is allowed to take pictures or do screenshots for the respect of the human remains. And of course, the presentations that we usually do in our institution when we run courses, of course, are widely involving human remains pictures, because that's the didactic purpose of the presentation. In this specifically webinar, as in other webinars, I will show very few human remains pictures cropped for the purpose of this lecture. Having said that, the presentation that I'm sharing with you today will reply to these 5 questions. What is a dental autopsy? When do we need a dental autopsy? Why do we need a dental autopsy in forensic odontology? What are the characteristics and the specificity that we need to bear in mind when we do a dental autopsy during the COVID-19 outbreak? And the question, are we ready for a virtual dental autopsy, a remote dental autopsy? And few conclusions on this topic. So what is a dental autopsy? A dental autopsy is something similar to a dental visit, but of course it's much different, because the difference in the observation of the intraoral areas of teeth, jaws, and all the anatomical areas of the jaws is particularly keen in describing details. So a dental autopsy is an intraoral inspection of a cadaver or more than one cadaver with the purpose of observing and recording the dental formula. The dental formula, which is for the specific purpose of the identification, is called odontogram, which is something more than the dental formula. All dentists, all oral health professionals, including dental hygienists, are full aware of what is a dental formula, because we treat patients every day. So we are aware that the dental formula is other characteristics of the teeth that are present, the teeth that are absent, that are missing, the teeth that are treated, the teeth that have some pathologies. The odontogram is something wider, because what we need to record on a dental chart for an identification purpose is related not only to missing sound or treated teeth, but it refers to many more details, including simply the position, the malposition, the rotation, the anatomical characteristics of a crown, the anthropological features of jaws and teeth. So it's a much wider collection of dental and anthropological information related to jaws and teeth. During the dental autopsy, we do the cleaning of the human remains in order to observe better the human remains. We take pictures. We take pictures using rulers, appropriate rulers, for the purpose of doing a real-time calibration of pictures. We take pictures of teeth, of all details, of the full skull. We may be called in reassembling fragments of human remains. We may found loose teeth. We may found fractured jaws and mandibles, and we may need to reassemble these fragments of bones and put back in the proper alveolus the teeth which have been loosed. If there are tissue on the face, we may need to do an incision on the side of the lips in order to open and observe better the intraoral area and perform X-rays, periapical X-rays, especially when there are rigor mortis. We may need to do these incision. And of course, we will take again pictures once we have a wide view of the full arches. And then we perform X-rays. The X-rays is one of the most important area and part of the dental autopsy. It is not conceivable to complete a post-mortem dental collection or a dental autopsy without performing a complete full X-ray, periapical X-rays of jaws and teeth, even in edentulous areas, and even if the patient is totally edentulous. This is a summary of the post-mortem area, because the dental autopsy is of course related to the post-mortem area where the human remains are under the observation of 1, 2 or more odontologists, also with the assistance of dental hygienists. Another important aspect related to forensic dental identification is not only the post-mortem area, which is of course something we do in the mortuary, next to the medical examiner or the forensic pathologist. We also need to continue in working and analyzing the dental data on two sides. First of all, after we have collected the dental data during the post-mortem collection, during the dental autopsy, out of this dental data, we need to create a biological profile. We do what is called forensic evaluations of all the dental data that we have collected. This means specifically we need to assess the age, because this is part of the biological profile. We have to analyze the teeth, we have to analyze the materials, we can analyze the type of prosthetics, we can analyze the pigmentations we have, the anthropological features of the palate and of some teeth. And out of this information, we have a generic biological profile, basically sex, race, social status, even geographical origin sometimes. Out of this information, we have the biological profile, which is shared with the law enforcement agencies, nationally or internationally, especially if we don't know the nationality of the unidentified human remain. And out of this biological profile, we allow police and law enforcement agencies to search for missing persons who are compatible in terms of the biological profile. So let's imagine we have a case where we find out that the person is a female woman from the age of 40 to the age of 50, or usually, as we say, 45 plus minus 5 years. This means that we address, with these only two information, we address a very strong, very powerful data that allows law enforcement agencies to narrow the search for all the missing persons that are compatible with the profile of a woman of the age of 45 plus minus 5 years. And this is part of another area of the identification using dental data, which is the search and translation of antemortem data. Once we have established a biological profile and we have referred this biological profile to the law enforcement agencies, they will start searching for the missing person reports which are compatible with that biological profile. This will narrow the possible compatible people who are reported missing, and this will allow a further search of information, medical and dental information that pertain to the families of the missing person. Of course, in this search, we are very important as experts, because also in the antemortem aspect of the dental data, we as odontologists need to translate into Interpol standards, into understandable codes, what is reported, for example, in a dental chart that we have, that police has collected from dental clinics, which may use specific abbreviations, which may use specific type of descriptions of therapies, but we cannot perform the final phase of reconciliation, of comparison of the post-mortem data of the unidentified with the antemortem data of the missing persons. We need, in order to achieve this positive identification, we need to compare compatible data. So the post-mortem data is already recorded applying best standards in human identification and Interpol recommendations using Interpol forms, which you probably already know. On the other side, we will translate the antemortem data, either the data which is coming from clinics, from dental clinics, but even data that is coming from the interview of the families. For example, the dental features like diastema, like malocclusions, like dental piercing, like habits, like smoking habits. All these information must be translated in an homogeneous way so that we can compare the post-mortem with the antemortem data and eventually achieve a positive identification because we have a match of information. This is what we do. We do dental autopsy is very similar from certain aspects to the dental checkup, to the dental characteristic. The difference lies also in the specificity of how we manage to collect this information. Ideally, there should be at least 3 experts, 3 odontologists, or at least 2 odontologists and a dental hygienist. In this picture of this training and exercise taken in London some years ago, where I was invited, you can see here, we are 3 forensic odontologists, each one with a specific role and quality control of the data collection recording. This one is Emilio, who is doing a PM observation. So I am observing intraorally in order to see which are the teeth which are present, which teeth have been treated, and if they are treated, what type of restoration sorry, it is, if it is a tooth color restoration, if it is an amalgam filling, if it is an onlay, if it is a crown, a fixed prosthetics, and also where it is located, if it is only on the occlusal face of the molar or the tooth, or if it is also in other areas, mesially, distally, etc. What I'm observing is also checked and verified by another odontologist who is there not only to assist and help the first odontologist, but is there also to verify that the information I am observing is correct, because I may mix up the tooth, I may think it is a first molar, what is a second molar, I may miss that that tooth is not a permanent tooth, it's a deciduous tooth, and aspects like this. So it is a second control, let's say, which guarantees quality and avoids any mistakes, because no mistakes are allowed. We cannot make any kind of mistake when we record the dental formula and the odontogram, because if we put a tooth which is absent and we put it as present, then we lose all the identification purposes and goals, because we will not have a correct match. We will never find the person we are looking for. So no mistakes are allowed. The third person here can be either a dentist, an odontologist, or a dental hygienist, is holding the forms, is holding the papers where he is writing what I am, the findings that we, with the other colleague, are finding in the mouth. So we are, of course, using gloves. We are touching the cadaver. So, of course, we need a third person, a clean third person, with the opportunity of writing down the data that we are collecting. So this is what we do. We can use an opener to observe. We may find perfectly preserved bodies. We can find bodies who are collected, recovered from the sea, and this is how they appear. You can see that there are fixed prosthetics and bridges in this mouth. We can find also totally skeletonized human remains. We may have to work on this kind of human remains where upper jaw and mandible are removed from the skull. This is something that personally I don't like. I don't agree in doing this. Most of odontologists do not agree in performing this kind of section of the inferior area of the skull, but this may well be also the remains of a very serious accident with commingled and fragmented human remains. We observe, as I was saying, we observe intraorally, we observe the type of restorations. You can see we can find inlays, onlays, but also we have to be particularly keen, and you have to pay attention also to resin composite restorations, which are basically now in the last 20 years, I believe that very few dentists are using amalgam for direct restorations. Basically, we all use adhesive dentistry. We all use metal-free restorations, either direct or indirect. The issue with the resin composite restorations is that they are extremely conservative. This means that we have to observe very cautiously the teeth, because we may have restorations in areas we may not expect. This means that when we observe the teeth, we should also use a specific UV light, like the one that I am showing in this picture, the UV light which highlights the resin composite and avoids any mistakes, any misrepresentation of the dental formula. The biggest part, anyway, of the dental autopsy, this is something that I have been stressing now for more than 10 years, is the use of dental radiology. The dental radiology is definitely the most important aspect of all dental autopsies. To achieve this result, we are lucky that thanks to a forensic expert, he's not a dentist, but he's an expert involved in forensic. His name is Steve Kinney, who used to work with a company from USA. He was the one who promoted the development of this portable X-ray device, which was used as a prototype for the first time during the tsunami in 2004 in Thailand. This is the portable device I still hold, I still have and still use this one. There are nowadays, there are several other models of this company, but also of other companies. They were already very smart. They were already light. I am holding this in my hand. This is about 3 kilos. The new models are smaller and much lighter. And the extraordinary aspect of these portable X-ray devices is that the odontologist can hold the device in his hand, and this allows to perform X-rays without having to go away from the cadaver. This is coupled with a digital sensor, which is what we call AVG. Most of us use already this digital radiology in our dental clinics. And the positive aspect of this asset is that we have a portable device, battery operated. We have an AVG digital sensor, which is connected to a portable laptop. This means that we can perform X-rays, periapical X-rays in any scenarios, from the archaeological excavation site to the mortuary area of a cemetery, like in this specific case, where we have no tools. So what I suggest is that all odontologists should be equipped with their own personal devices, their own personal equipment, in order to be sure that they bring with them whatever they need to perform the dental autopsy. This is what I do. I have 2 Paley cases like this one. One is for the X-ray, the other one is with all the other instruments, rulers, cameras, and other instruments that we use. We are using this now with other tools. I will explain you later during the question related to the remote virtual dental autopsy. You can see here the portable device is allows you to fix and to decide the exposure time, sorry, of the X-ray, and you hold it, and it's very easy to do as many X-rays as you wish in order to achieve this kind of result. The X-rays that we must perform in all dental autopsies for the purpose of human identification is the radiological status of jaws. So we need to perform periapical X-rays from left to right, from upper to inferior mandible, in order to have the total view of jaws, even in those areas where we don't have teeth. The radiology that we use on teeth are also used applying specific formulas for the age estimation. In this specific case, on adults, I am particularly keen in using the formula invented by Roberto Cameriere, forensic odontologist from the University of Macerata. All of you involved in forensic odontology well know the competence and the research experience of Roberto with the formula that he has launched together with his research team. And as I said, the dental age, the age assessed through teeth is another very important data of the biological profile of the human remain. It's thanks to the age that we can have a very important cutoff. Age and sex of the unidentified is an extremely important data to narrow the search for the compatible missing persons, which will be compared for the final reconciliation phase. This is what we have assessed in that specific case. You can see here the huge details, the wide details that we need to use, not only in terms of descriptions, but also in terms of codes and in terms of a graphic vision of the dental formula, which is called, in this specific layout, is called odontogram. Here you see the extremely feasibility of our devices. The digital sensor is connected to a portable laptop, and you see digital images. It's useless, I'm sure it's useless to remind you how smart and useful is the archive of digital X-rays, digital pictures. They can be stored, they can be enhanced, they can be cropped, they can be transferred via email, they can be recorded and stored forever. And this is extremely important because when we perform a post-mortem of an unidentified human remain, we are, except with some exceptions, we may have no clue of who this person is. And of course, the identification phase will be achieved only when we will be able to obtain some information for the comparison phase. Until then, time may pass, and this means that we may still need to keep these pictures as long as it is needed, because we may end up identifying the person the day after, but we may need more months, more time to achieve a positive ID. Nevertheless, I need to highlight and stress the importance of a dental autopsy, because it is the only forensic approach on cadavers, on unidentified human remains, that allows the achievement of a generic profile. So when you have to perform an identification of an unidentified, of uncertain nationality, you definitely need to appoint one or more forensic odontologists, because it's only the dental autopsy which will allow investigators, police, to have a generic profile and to narrow the search for the missing persons who are compatible. With the other tools, which are, of course, primary tools for the identification, like DNA and fingerprints, we are not in the position, in the condition to achieve a generic profile. So we have to do a combination of those primary identifiers. The primary identifiers which are used to identify a person are DNA, fingerprints, and dental data. This doesn't mean that we cannot use multiple identifiers. We can use all primary identifiers if necessary. We may achieve a positive identification only use dental data, or we may achieve a positive identification using dental data combined with a final confirmation of DNA or fingerprints and the final confirmation of DNA, or fingerprints and the final confirmation with dental data. The combinations are very easy to understand. We can have a combination of all primary identifiers, including other adjunct evidence which is used for the identification, which are called secondary identifiers. This is the tool I was telling you about, and this is this shows this case. This specific picture is just to show you the extremely importance of performing X-rays straight away on human remains, especially when we deal with burnt human remains, which are extremely fragile, like this fragment of a mandible. You can see that I performed a periapical X-ray of this fragment of the mandible, obtaining this image, which shows you the endodontic treatment of this inferior molar. And this is the antemortem crop of the panoramic image of the person that was identified. You can see the compatibility with the image and also the characteristic of the second molar, which is present, although is missing post-mortem. The idea of charting a tooth as missing ante-mortem or missing post-mortem is extremely important. And again, in this charting of the dental formula, 0 mistakes are allowed. This is a similar case on the other side. This shows you another important aspect I stress when I do lessons, when I lecture to undergraduates and postgraduates forensic odontology, which is the evolution of the dental treatment. And this is why in order to be a very good odontologist, forensic odontologist, you need to be also a very good, very well experienced dentist. This means that to become a forensic odontologist, it is advisable to have also several years of experience in dentistry. You can see here this OPG of the same person, which is what is then defined as antemortem OPG. And you can see on the left that there is no prosthetics, but there is a second molar missing and a second premolar missing. And in the unidentified human remain, we found this bridge, which is compatible and is exactly the bridge which was applied on the same person years later with respect to this OPG, which is older. Still, there is a compatibility and there is a match, because this small molar is exactly the cantilever of this bridge, and these two are the pillar of the bridge. So even if we have very old panoramic X-ray images, we still are in the position to use them as a very valuable tool for the comparison of dental data. Useless to remind you that there is the discipline forensic odontology, basically because teeth are the most resistant part of our body. You have forensic odontology and you have forensic dental identification, because dentistry, because teeth, even sound teeth, hold so many identifying features that remain there even after heat, after chemical substances, after time. So the extreme durability of dentition, including the durability of our dental treatments, endodontic treatments, fixed prosthetics, mobile prosthetics, implants, endodontic post. I don't have to remind the dentists all these dentistry which we perform in our patient, which are extremely resistant as well. But we also have anthropological features of the crown and even shapes and features of roots. So we may also achieve a positive identification, or at least achieve a compatible compatibility with the unidentified and the missing persons antemortem charts only through the characteristics of a specific routes. So even in very sound, perfectly sound teeth, we can achieve and we can obtain valuable information for the identification process, which is a process. It's a process where we collect day by day information and data until we achieve a final match of several evidence. Of course, we also can obtain DNA from the teeth, and especially when we have human remains which are skeletonized or carbonized, the pulp in teeth is one of the most used tool mean to obtain DNA, because of course the chamber, the pulp chamber of the tooth is protected by the hard tissue of the tooth itself. Of course, we have also other features we can use for identification, like for example, the features of the sinus, the shape of the maxillary sinus, and we can also perform specific analysis of dental materials in order to obtain the formula of the dental materials which are used in the teeth of the unidentified, in order to achieve the brand of the company and eventually the geographical origin. Of course, we need to collect all the information, as I was saying, in what will become an analysis, a biological analysis, a biological profile, or as I described in 2011 in this meeting in Madeira, I like to call it also dental biography, because thanks to our clinical experience as dentists as well, we can achieve not only a generic profile of race, sex, and characteristics, anthropological characteristics, but we can also achieve some information related to the social, economical status, the oral hygiene, and even some dietary habits that the unidentified person may had when alive. This is the portable device, and this is the digital software that the UK DVI team is using, which is the digital translation of the Interpol forms into a specific software. Not all police agencies use Plus Data, which is this software. Nevertheless, nowadays, the Interpol forms, which can be downloaded and printed on the Interpol website, are used in all DVI, disaster victim identification scenarios, sorry, because they allow a multinational exchange of data. Imagine when we have a DVI scenario, either because there is a terroristic attack or because there is an accident, a train accident, a flight accident, an earthquake, an hurricane. Most of the time, we face more and more multinationals casualties. So we are in the position to have to identify people belonging to several nationalities, and we need to work sometimes on a multinational way. Sometimes there is the involvement of DVI teams of several nationalities, which are called on site either to support, either as an adjunct assistance, or simply because there is a cooperation through Interpol, because Interpol calls in DVI teams from the countries which are probably involved in the accident. So for this reason, we cannot speak all these languages. We need to use forms which can be easily understood by anyone involved, independently for the nationality. And Interpol forms, Interpol forms are a universal language, because the Interpol codes are known by all DVI teams, and this allows a universal exchange of data. This allows the opportunity of working together on a multinational level without any risk of misunderstandings. Again, you can see the comparison between the software and the paper. It's a translation of the paper into a software. One of the aspects that I stress also more than 10 years now, since 2006 actually, is the distinction between a dental autopsy and a dental examination. Now, you can see here the difference. The difference basically is the difference in terms of quantity and quality of data. In a dental autopsy, we collect all identifying features, everything which can be used for the identification, even pigmentations, rotations, particular characteristics of crowns, particular characteristics of the shape of roots. So the dental autopsy charting is extremely detailed and goes extremely into details. On the other hand, the dental examination is something that you do every day when we perform dentistry in our patient. There is a patient that refers to us for a pain, so we do a dental visit, and of course we check if there are any pathologies, if there is a pocket in the gum. We write if there is a caries or if a tooth is missing. But basically what we write when we do a clinical visit from a dental point of view has much lighter information related to the dental autopsy. But this is one of the reasons why the community of forensic odontologists are also stressing several associations, including dental orders, dental councils, in order to highlight to dentists the importance of charting more details of their patients, because this is something that we should start thinking of doing as dentists, also in order to protect our professional aspect, because we may have some complaints from patients, and when we need to defend our work, when we need to respond to a complaint, if we have a clinical chart full of information and full of details, our position, it's easier to be defended in terms of a complaint from a patient. So from this point of view, the more details we write on a dental chart as a dentist will allow, of course, a better work also from the forensic point of view when there is the need for the identification. These are the two 600 pages of the Interpol forms that we use. And here you can see the codes that we need to learn. They've been reduced in years, thanks to the meetings that we do every year in the Interpol headquarters in Lyon or in Singapore. There is an annual DVI conference where I participate as Italian odontologist expert. I participate since 2010. And the codes, the Interpol dental codes have been reduced. Nevertheless, there are several codes, and this to show you that the difference between the dental autopsy, because in the dental autopsy you must use these codes, and the dental examination that we do in our dental clinics, that is characterized by our own kind of abbreviations that we may like to use in our private practice. There are also some color coding if there is a caries, or if there is a composite filling, so that, or if there is a gold direct, indirect restoration on tooth, this color can be used to enhance the visual comparison of odontograms in the Interpol form that I showed you before. So when do we need to do a dental autopsy? Well, it's very easy. Anytime you need to do an identification, anytime you need to do an identification, you should rely on primary and secondary identifiers. Specifically, in order to achieve a positive ID, you need to assess and verify at least one primary identifier combined with a secondary identifier. This means that we can have a combination of primary identifiers, or we can have a combination of one of the three with a secondary identifiers. Secondary identifiers, very easy to highlight: tattoos, scars, personal belongings, and also in our oral area, there could be so many features that are not dental treatment, that we will not obtain from dental clinics, but we can obtain by simply searching on social media or searching for portrait pictures of the missing person. We have all these type of piercing, which are, of course, identifying features. We will not identify a person based on a piercing, but we will use this information as a secondary and adjunct information to combine with other primary identifications data, including earrings, jewelries worn by the unidentified, including orthodontic retainers, old models that we may still hold at home, or dental technician laboratory could still archive, or orthodontist could archive, or we may still have in the house of the missing person, we may still have a mouth guard for the sport mouth guard, or those bleaching tray that we dentists create in a tailored way, because they are taken out of an impression, which is what we do when we do a bleaching of home bleaching of patients. The patient, the missing person, may still hold these bleaching trays at home. And of course, these bleaching trays, for example, as the mouth guard, is a tool for DNA, because there is a dry saliva on it, or we can use this and obtain the positive replica of teeth, because we can use the chalk to do this, and we have the arches of the missing person, and then compare it. We developed an app, very easy, very simple app, a free app called Selfie Forensic ID, in order to wide the distribution and circulation of selfie images showing the teeth. Because selfie images of a smile, they have a name, a surname, and so out of a selfie image, we obtain information about dental characteristics, diastema, rotation, malposition, if there is a crown, if there is a fracture. We can obtain various information, identifying information. Again, we do not achieve a positive identification because of pictures, because of portrait pictures or selfie pictures. These information is an adjunct information that can be used to narrow the search. And we don't use visual recognition, not we as odontologists. Interpol do not recommend the use of visual recognition because it's a very unreliable tool. Here you see pictures of so many faces, and it is amazing. All these people here do not exist. All these faces that you see here, it's the elaboration of a computer, it's the elaboration of the artificial intelligence. If you go on this website, this person does not exist.com, every time you go on this website, you will see a different portrait picture of a person which practically does not exist. But this to show you how unreliable is visual identification. This is one of the victims of the tsunami 2004. when she was alive, when she was found, the somatic characteristics of the face are completely damaged, completely different from reality. So we cannot rely on a visual recognition. We can rely sometimes on this. We also use visual recognition sometimes. It is not something that we do not use, of course, but we have to be very cautious in doing an ID based only on visual recognition, because there are recorded mistake cases where victims have been mixed up, and with all the consequence, with the sorrow, with the families, with the funerals, with the insurance, etc. I will go over this because I would like to go to why do we need a dental autopsy and why do we need forensic odontology. Well, I told you we need to do identification, and we are very important as one of the forensic sciences discipline, because thanks to the resistance of teeth, we achieve a positive ID. Nevertheless, there are DVI scenarios which can always be different. There are incidents and accidents like tsunami in South Asia in 2004, where most of the identification was performed using dental information alone or combined with secondary identifiers. This was the condition of the victims, but there are other identification emergencies like the one that we face in Europe and specifically in the south of Italy, which is the migration flow, because we have unfortunately a lot of migrants who die crossing the sea. And of course, in this aspect, dental information should be used in order to achieve a positive generic profile, but it is unlikely to achieve a positive identification using dental data, because it is very difficult to obtain dental information from the country of origin of the migrants who are dead. Nevertheless, if we consider the number of victims that have died crossing the sea, you have this picture of the Guardian that shows that each of these dots here in this image, each of these 34,361 dots is a dead migrant, died crossing the Mediterranean Sea or died traveling over land. And one of the sad aspects from the human rights point of view is that just over 1,000 have a name. This means that 33,000 are still unidentified. And of course, this is one of the reasons. The reason for the identification are listed here, but I would like to stress the one which is the reason that inspires our work as volunteers, which is the respect of the human rights of the dead. I highlighted this aspect for the first time. It was highlighted for the first time in an international conference of the International Dental Ethics and Law Society Congress. This was in Belgium in 2012. That presentation was published as an article. For the first time, it was addressed and stressed the importance of giving an identity and a name to dead migrant and to unidentified missing person, stressing the importance of using forensic odontology, of doing dental autopsy. In 2013, during the Interpol meeting in Lyon, I highlighted also the need of using DVI forms only in the unidentified missing person, because it was unacceptable from a logic point of view to use DVI forms only for the identification of the victims of mass disasters. You should use, and in fact nowadays everyone uses Interpol DVI forms also for single cases, also for single unidentified human remains. And this issue of highlighting the importance of protecting the human rights of the dead and the human rights of the family of the missing was pointed out very well during 2015, where I presented the constitution of the group on the 5th of May 2015, which was initially called Forensic Odontology for Human Rights, which then became an association, Association Forensic Odontology for Human Rights. So we changed acronym from FOD for HR, we changed the acronym to AFOR, Association Forensic Odontology for Human Rights. Since then, we have, of course, our website, we have our logo, which identifies what? It actually identifies for humanitarian forensic odontology. Humanitarian forensic odontology is the use of experience and competence in the human identification process for humanitarian purposes, together with the International Red Cross Forensic Unit, together with the Commission of Humanitarian Forensic of the American Academy of Forensic Sciences. We promote humanitarian forensics in the specific field of forensic odontology, specifically in human identification and age estimation. And I take this chance because I always like to share the success of our work and the opportunity of protecting the human rights of the dead with the board members of AFOR, Professor Emlata Pandey from India. She is also president-elect. She will be AFOR president in next year in September. Professor Ivana Kukovic-Bajic from the University of Zagreb in Croatia. Dr. Lisda Kansar from the Indonesia DVI team. Professor Shalini Gupta from India. Dr. Avi Untoro, forensic pathologist from Indonesia and DVI Indonesia. Professor Abraham Johnson from Gujarat University. We have also, what is his name? I always forget. Timur Baig from Dr. Imor Baig from Pakistan. Professor Jason Moraes Marquez from Brazil, and Dr. Wassim Riawi from Syria. Of course, we have also Professor Niraji Taneja from India, my colleague, forensic pathologist from the University of Turin, Professor Francesco Lupariello, and myself. You can have a walk, you can surf on the web and go on our social media. We are our most important social media. We also have a YouTube channel if you want to follow our work or if you want to join the association. Specifically, we have developed the 8 sustainable goals in forensic odontology. But most important, I would like to invite you all to this conference, which will be our first international symposium on forensic odontology for human rights, which the theme will be Rescue, Dignity and the Rights of the Dead, organized in Mumbai next September 2021. Now, just few details. If you are not tired, are you tired?
No, sir, you can go ahead.
Okay. Happy you are not tired. Then something that we cannot, of course, avoid to talk about. We cannot avoid to talk about COVID-19, also from the point of view of a dental autopsy. As you know, the World Health Organization announced the outbreak on the 11th of March 2020, creating, of course, also some challenges also in the forensic field. If you go this morning to the Johns Hopkins University website, you have a real-time updated data of the positive cases worldwide. We have more than 837,000 dead people out of the COVID-19. But we also have more than 60 million people who have recovered from COVID-19. But if we go on and this is of course the data of this morning. Unfortunately, the issues of COVID-19 has inevitably involved doctors, medical doctors and dentists. And I like to remember the colleagues, the Italian colleagues who have died in Italy due to COVID-19. They have reached the number of 176 doctors. There are also few dentists in these numbers, and this is the reason why we need to pay attention, because also odontologists, also forensic practitioners may face, of course, issues security. And this means that we need to be aware of the protection that we have to wear. On the crime scene, we may find, we may not know the victims, because one issue is to perform an autopsy of a patient who has died in an hospital. And of course, you have a clinical chart, you have a name and a surname, and you have a medical history. So you know if the patient was COVID-19 positive, SARS-CoV-2 positive or not. But we may have to work on a crime scene where we find a victim, where we don't know anything about his medical history, his travel history, and we have to consider this person as possibly infected. And for this reason, we have to take precautions. And this is the same reason why we have to be very, very cautious when we perform an autopsy. In particular, SARS-CoV-2 virus has a very strong survivability and resistance to cold environment. This means that if we are asked to perform an autopsy on an identified, who has been stored, of course, low temperatures, we will still have the risk, of course, of having to face contagious issues. And the virus, in fact, survives in human remains for a period of time after the infected person has died. And in particular, the cryopreservation may prolong, of course, this persistence of the virus in the body. We have what is called an occupational exposure. This means that we can still get contagious, we can still get the virus from the droplets, from the respiratory droplets, from the aerosols, and with contact with the viral secretion. So there is the risk of inhaling the virus injury during the use of sharp instrument, or because there are body fluid, because we are in contact with body fluids during the autopsy. What we are wearing is personal protective equipment. Of course, we need to wear a surgical uniform over which we have to have a scrub, and with long sleeve, waterproof or fluid resistant gown to protect chest, arms and legs. We need to have a disposable apron covering chest and legs over the waterproof gown, because the waterproof avoids, of course, the penetration of humidity. And we also need to wear double non-sterile gloves preferably nitrile gloves. And of course, these gloves must be long enough to cover wrist. This second nitrile gloves can be changed frequently if needed, and we have still one underneath. We also need to wear, or to have available the heavy-duty gloves over the first nitrile glove if we need to perform some incision, for example, the incision of the cheeks, as I was saying at the beginning. And we also need to consider the use of a whole body suit. Most important aspect is also the use of goggles and a plastic face shield together. So goggles and plastic face shield on our face mask to protect, of course, face, eyes, nose, and mouth. And also the masks. The masks that are advised are the FFP2 or FFP3 filtering face masks, which provide adequate protection. We may want to do also 2 masks. We may want to consider using an FFP2 or an FFP3 mask and use a surgical mask over. This is what I do when I work as a dentist personally, because during dentistry procedures, we have the production of a lot of aerosol, so more than autopsy. So usually when I work in clinical dentistry, I use 2 masks, an FFP2 and a surgical mask, and also a face shield, and also goggles. We want to use also rubber boots and waterproof shoes protectors, and of course, cover our head. There is an interesting issue related to what is the real capability of the autopsy suite, of the autopsy room, of the mortuary, because we may find ourselves working in areas geographical areas where we don't have all these equipment, and we don't have enough PPE. And for this reason, we don't want to put at risk our life. So we consider the idea of postponing the dental autopsy. There is, in this specific condition, there is no need in fastening the dental autopsy procedures if there is enough to protect at least eyes, mouth, and hands with physical barriers. We want to postpone the autopsy, the dental autopsy. 2 questions, and I'm going to the end of this lecture. What about virtual dental autopsy? Are we ready? This was the subtitle of today's presentation. Are forensic odontologists ready for a virtual dental autopsy? This is something we are working on at the Human Identification Laboratory at the University of Turin. We are working on the idea of improving and achieving specific protocols for virtual dental autopsy. It was something published already in 2012 in this revista Odontoscienza. If you go on the website, there is a colleague, Dr. Ademir Franco do Rosario Jr., who already published in 2012, together with other colleagues from Belgium, from the University of Leuven, an article on the virtual autopsy in forensic science and its applications to forensic odontology. The idea of a virtual autopsy comes from the idea of virtopsy. The virtopsy is a virtual medical legal autopsy invented in Germany, which uses CT scan, which is used to perform a judicial autopsy on the whole body. The idea of doing this also from a forensic odontology point of view, it's interesting for some aspects related to the lack of forensic odontologists in some areas. There are areas where we don't have odontologists, and if you want to respect best practice in human identification, if you want to apply Interpol recommendations, and if you want to respect the human rights of the dead, we need to work properly. We need to work respecting protocols. This means that we need to perform a dental autopsy. So if you don't have a forensic odontologist on site, what would you be doing? You could rely on the virtual autopsy. At least this is the idea. There is a recent article on the International Journal of Forensic Odontologists last year, which is an open access article. And again, you find here an imaging technological integration in forensic odontology. Basically, it will be based on imaging, because imaging can be collected on site, on the human unidentified, and images can be transferred telematically anywhere in the world. And this is the concept behind the virtual autopsy. Of course, more to come. I cannot reveal right now what we are doing here at the University of Turin, but more to come on the idea of virtual autopsies. And let me go to the conclusions, specifically related to the COVID-19 outbreak. So DNA and dental should both be considered when performing an identification autopsy in this outbreak of COVID-19. But of course, in this specific moment, if dental autopsy is too risky or too labor intensive, then DNA should be considered a stronger substitute for the identification. Also, it is important to verify that forensic practitioners involved in medical legal institutes department are full aware of the protection protocols, of the PPE that they have to wear, and also on the infection prevention and control practices and management. This is fundamental in order to avoid any risk and protect our life. Nevertheless, risks should not prevent us as odontologists in the application of best practice in human identification. This means that we still always have to stress the use of primary identifiers in order to achieve a positive ID. In order to balance safety and respect of the human rights of the dead, the solution is to be particularly keen in infection and safety protocols, which can be first learned, then planned, then prepared, and then work with more experienced experts when entering in the autopsy suite. This is something I already stressed. We cannot accept incomplete human identification procedures, because this is a violation of human rights, because the human rights belong to a person, and the person continued to be a human being also after death. And if you reflect on the rights aspect, we have our rights as citizens because we have a name and a date of birth. Without a name and without a date of birth, we have no identity, we have no rights. That's why it is so important to achieve a positive identification. And that's why avoiding to involve odontologists in the identification procedures represents a violation of human rights, because can postpone the human identification process, or even avoid the identification process at all, because the dental autopsy and the forensic odontology evaluation can achieve a positive identification on an average of 70% of cases. Of course, this will depend also on the status of the human remains, but nevertheless, if we look on the literature and we see all the different cases, you see the significance of forensic odontology in the human identification process in terms of percentage is on an average of 70–80%, alone or combined with secondary identifiers. Also, not only human rights of the dead to be buried, to receive a funeral, to receive a proper management of their will, of their finances, but also the human rights of the families who have the right to know the fate of their beloved and to close the mourning. This is the outside of our Medical Legal Institute in Turin, where I have the privilege to be researcher and professor of legal medicine. I give you and I bring to you the greetings of Professor Giancarlo Di Vella, who is our director of the medical legal section here in Turin. I am open to any questions. Before opening to any questions, let me invite you, and this is the very last slide, to an event we will do on the 10th of September in Turin in our institute at 10 o'clock European time, at 1:30 Indian time. It's going to be an online event through WebEx. It is related to the award that we as Association Forensic Odontology of Human Rights will award to Professor Italo Robetti. Italo Robetti is a scientist, is a researcher, is an expert in forensic odontology. He is a pioneer for the promotion of forensic odontology in Italy. He is the one who started to be involved in forensic odontology in Italy, imagine, since 1974. He is probably the first Italian forensic odontologist who has been working in this field. And for this reason, we, this time as Association Forensic Odontology for Human Rights, we will offer to Professor Robetti this award in recognition of his work. Having said that, I am open to your questions.
For those who are watching via YouTube, please leave your questions in the comment section and they will be asked to the doctor as well, Dr. Emilio as well. Dr. Arvind, do you want to make a conclusion of the lecture, sir, from your perspective?
I shall do it after the questions are over. I'll be happy to do it then at that time. Okay. Okay.
Yes, your questions in the comment section and they will be asked to the doctor as well.
Back.
You want to make a conclusion of the lecture, sir? Dr. Emilio, we have a question from Dr. MJ Nanjan. What is the status in India when it comes to DVI and human rights of the dead?
I am aware that there are several universities involved in forensic odontology. I am aware of the enormous efforts that they are putting. I am aware of what is doing the Chandigarh and Mumbai. I am aware of the Gujarat University, where there is a specific course on forensic sciences, but there are other areas. Actually, I have to tell you that India is probably one of the most active countries in the world who is doing research and working in forensic odontology. For example, imagine in the Association Forensic Odontology for Human Rights, where I am at the moment the current president, probably the majority of members are from India. So having said that, I cannot give you specific details about what is the exact situation. But from what I read, from the articles I read, which have Indian experts behind, I can say that serenely that it is applied correctly, and there is a lot of work behind. So I'm very proud of what you are doing in your countries, because you are going in the right direction. Promotion of forensic odontology, especially in the field of human identification. I would be a little more precautious about the use of forensic odontology for bite mark analysis, because your judicial system is similar to other Commonwealth countries, and you have a common law judicial system, which is a little bit different from the, for example, our system in Italy, where we have a civil law system. So in Italy, we have a system with three parties: the accused, the defense, and the experts appointed by the court. So we have three experts working. One is beyond the parties, it's super partes, as we say. In India, you have two parties, and you may face risks like related to bite mark analysis in crimes, of course. You may face the same limitations and difficulties that USA is facing when dealing with bite mark evidence. But this is, of course, something different from today's topic.
Yes, sir. Another question from Dr. Pooja Kalita. How to overcome a conclusion? How to come to a conclusion if AM records are not at reach or unavailable?
Well, you need to forget the idea of achieving a conclusion. You are not asked to achieve a conclusion. Of course, you achieve a conclusion if you can. You are an expert witness, you are an expert in forensic sciences, you work with the evidence and the data you collect. If you can achieve a positive ID, then fine. If you cannot achieve a positive ID, the idea here is yes, we need to achieve a result. Yes, we want to achieve an identification, but the aspect which is before the result is how you work. An expert in forensic sciences must apply best standards in human identification. This means that you need to collect post-mortem dental data, because you must respect the medical legal criteria, the forensic sciences criteria of human identification. So it doesn't matter if you will not achieve in the future a positive identification, because once you perform a dental autopsy, in that moment, you need to collect as many as possible information from the jaws and teeth, because that should be a process which should not be redone again in the future. So once the coffin is closed, once the human remains are buried, they should not be exhumed. This means that on that body, on that specific body, in that specific moment, you don't have any clue of who this person is. But you still have to collect all the post-mortem identifying features, including, of course, dental data. The final positive identification is a process. It's a complex process. Out of our dental data, you obtain a generic profile, then you narrow the search. You may have to do, you may arrive to a stage when you use other tools, like, for example, the facial approximation. You do a replica of the skull, you do a replica in resin, or you use a 3D software, like Professor Aman Chaudhry from India is one of those experts that does this kind of facial reconstructions. You start doing also these other tools to achieve a positive identification. Of course, very complex cases may remain cold cases, let's say, but this is something you cannot say when you are performing an autopsy, right? In that moment, you don't know the information that will be eventually available in the future, near future or far future, you still have to perform a dental autopsy and a dental profile. Then, if you don't have enough or you don't never get AM data, you have still worked for the purpose of you doing the identification because you have achieved a generic profile, which is one of the strongest way to start at least the search for the compatible missing persons. Dr. Swati, the microphone, please.
Thank you, sir. So Dr. Aman Chowdhury has asked if there are any internationally accepted trainings available in Turin, Indonesia or USA.
I thank Aman for the question. There are several training courses available. Of course, there are some courses which are not in English. So even if there are, even in Italy, there are some courses, some masters in forensic odontology, but they are in Italian. So unless you learn Italian, you will not be able to attend. I am aware of short courses in USA, in Texas. There are fellowship courses in forensic odontology. There is a very good master in Leuven University in Belgium, but there is a very good postgraduate course in Dundee University in Scotland with the Professor Sheila Manica as coordinator of this postgraduate course. There are also short courses, sometimes 1 week, proposed by the International Organization of Forensic Odontostomatology, IOFOS is the acronym. And there is also a postgraduate course in forensic odontology in my university in Turin, which is running this year. It's active this year. And this course could be also interesting because it is not a master, but it is similar to a fellowship because, and it is interesting not because it is in my university, it is interesting because it is in English, or it is, most of it is in English, and it will be run also next year starting in February. There is also a distance master run by Professor Bob Dorion from Canada, from Montreal, and to my knowledge, this is what is out there. You, of course, have a big issue, which is a big problem when you need or you want to be trained in forensic odontology. The issue is that you need to travel. What I've been learning in forensic odontology is something that, of course, has been started in Italy at the University of Bari in the south of Italy, as well as the University of Florence, but it has continued going to several other courses abroad, including short workshops organized by the American Board of Forensic Odontology, and week courses organized by IOFOS in the Scandinavian countries. Of course, these courses have the advantage of being run in English, and of course, this allows these courses to be attended by anyone in the world. If you need more information because you like the idea to consider Turin as one of these possible tools for training, the positive aspect is that our course is, you don't need to be in Turin. You don't need to stay in Turin, and as a monthly meeting, because it's not a master, it's a postgraduate diploma in forensic odontology with every month we have a meeting. But thank you, Aman, for the question.
Sir, Dr. Anup Bose has asked, how can respiratory droplets be a threat to the odontologist during performing dental autopsy?
It depends on because it depends on the temperature of the room. It depends on the presence of fluid. For this reason, to prevent any, of course, you don't have droplets like in dentistry, but you may have contamination in the air because you may be working, because first of all, the area must be very ventilated so that you change the internal area of the room. So one of the suggestions that we have found and we have put down in the article on dental autopsy in SARS-CoV-2 patients is the use of cotton in order to close the nose orifices so that you don't have any risks. Because when you are working near the mouth, you may get near in order to observe, and you want to be sure to be closing the nose with cotton pellets, with cotton rolls, the cotton that we use in our dental clinics.
Yes, sir. So another question is from an anonymous attendee. What are the problems that you have found while dealing with dental and teeth identification?
Well, every time, every case is specific. I mean, I would not call them problems. I would call them issues, concerns that you need to work on, because most of the time we as odontologists face the fact that the police forces, that judges are not aware or are not full aware of the importance of forensic odontology. Sometimes I've been appointed in doing human identification of human remains because I addressed my availability, pro bono availability, to the penal court. And the magistrate, when I met the magistrate, said, I would have never thought of appointing a dentist for the identification if you had not pointed out all the work that you can do out of the jaws and teeth. So this is the problem. Basically, the problem is the fact that we still need to, as odontologists, as community, we still need to highlight the need of forensic odontology. The real problem is that we don't do it. I mean, all the meetings that we do as odontologists, and of course all odontologists are fully aware of the need of more forensic odontology in human identification. So this is the reason why, for example, when we work or when we do events with the Association Forensic Odontology for Human Rights, our idea is to promote our discipline in other areas of forensic sciences, in those areas where they are not full aware on what we can offer as contribution to the investigations. Every time there is a dental evidence, I think, phase, create more awareness worldwide on what we as odontologists or as experts in forensic odontology can offer in the field of human identification. But don't forget also the field of age estimation, because the need for age assessment is another judicial proceedings, very important, especially when we have illegal migrants that address themselves to be minors.
Thank you, sir. So another question by Dr. Manu is, what are the limitations of a forensic odontologist with relevance to legal aspects?
Sorry, to which aspects?
Legal aspects.
Well, the question, I understood, or better, if I have understood the question correctly, the legal limitations are somehow related to national jurisdictions. I can explain or I can address the condition in Italy, I'm not sure that this is exactly what would happen in other areas of the world. Nevertheless, I believe it's going to be similar. In Italy, a body, if you have a human remain, if you have a body, a dead body, the person in charge of managing the body is, of course, a forensic pathologist, a medical examiner. So an autopsy is performed by a medical examiner, and the medical examiner, let's say, is the chief of the all autoptical procedures that may be required on that body, either because either to assess the time and the cause of death, or because you want to assess the identity. Nevertheless, odontologists, and this has happened sometimes in the past to me, could also be appointed directly by the court. So to do an autopsy for the purpose of human identification. This means that the legal limitations or the legal aspects are that you have a human remain, the court appoints a medical legal doctor or a medical examiner or a forensic pathologist. These definitions are all synonymous. You can call it, we call it medical legal doctor in Italy. USA call it medical examiner. Other countries call it forensic pathologist. Is a medical doctor specialized in legal medicine, sorry. So he is the one in charge of the autopsy. He is the one who is authorized to appoint other experts to be involved in the human identification process. They can be a biologist, they can be an anthropologist, and they can be an odontologist. So this means that the medical legal doctor is the one in charge of the management of the autopsy, and he is authorized to appoint other experts. You may find yourself in another situation where the medical legal doctor, the forensic pathologist, is appointed by the court simultaneously with the forensic odontologist. And this is what I would prefer. This is what I am trying to push, which means that they are both responsible for the autopsy and the identification process. But you may also find yourself as an odontologist, as I was telling you, it has happened in the past. You may find yourself be appointed alone because the autopsy has already been performed, for example, previously in another time, and the body is exhumed, and the court asks the odontologist to perform a complete dental autopsy, which was not performed when the body was recovered. So you have three different situations. The medical legal doctor in charge appoints the experts. The medical legal doctor or the pathologist is appointed together with an odontologist, or you, an odontologist, could be appointed alone to perform the dental autopsy. I hope I have answered to the question of the colleague.
So we have questions coming via YouTube as well. One person asks, what are the latest software or digital technology in forensic odontology which can be applied or helpful in other dental fields? Dr. Shivangi asks this question.
Well, this would open a very big discussion. I can summarize the answer by saying that one of the aspects that we need to work on is the latest technologies. This means from the point of view of storing data, we should start thinking about blockchain and storage of data for identification. Blockchain is a technology used for cryptocurrency. It's a way of circulating data without the hierarchy of the traditional database. Let's call it this way. This would allow data to be transferred very easily from different stakeholders. Then we need to work also on the artificial intelligence. There are several universities, including Turin. We are working on artificial intelligence and also machine learning in order to use software to recognize age out of X-rays. Then we should start working also on imaging and particularly to spectrophotogrammetry, which is what we as dentists are using for what is called dental scan, which is the optical impression of our patients. We are working also as a university on this specific tool of spectrophotogrammetry in order to have impressions of optical impressions of jaws and teeth, not so that we don't touch human remains with impressions. So this and another interesting aspect which could be used and some universities are using is also the augmented reality. This is something we should work on when we need to collect evidence, for example, of a bite mark. We may want to use augmented reality when we need to do, we need to collect pictures of bite mark lesions on a victim, so that we can do a real-time calibration of the images. But again, these questions open the discussion to so many other fields. The conclusion on this is that we still need to work on science in order to make forensic odontology a more scientific and more scientific discipline, in order to prevent any criticism, and of course improve our work as contributors to justice.
So final question. Dr. Nanjan asks, what would happen if in a disaster situation, you cannot identify the victim?
Well, in a disaster situation, in my experience, again, when there is a DVI process, you process human remains respecting protocols. So human remains are stored considering each fragment of human remain as a person. Each fragment is treated evaluating anthropological features. If these human remains are feet or hand fingerprints, footprints are taken. If there are dental features, dental assessment is done together with the dental X-rays. And of each fragment, a little fragment is processed to archive a DNA profile. So you store of the all human remains, depending on the quality and the status of the human remains, each fragment, each body or fragment of body is stored in a dignified way, wrapped usually with a specific number that identifies only that fragment, and each fragment is also referred to a DNA profile, so that these fragments are stored in refrigerators until there is the chance of comparing profiles. When you find yourself in a DVI scenario, usually you will reach a time, a day, when you have the final list of the missing people that were involved in that scenario. If you have a flight that crashed in an open space, in an open area in the country, you have the list of the passengers. If you have if you have an accident of a building in an urban area, you don't know at the beginning the people who are involved, but you will reach the stage when you have the final list of the missing persons that were involved in that scenario. This is actually another aspect of technology that we as association started to work on. Then we left this project because we don't like to be involved with commercial initiatives. We want to work on a humanitarian aspect. One of the idea was to use mobile phones to geolocalize the victims of a disaster, because when you have a disaster, you have also living people, you have injured, and you have victims, dead people. So you using the mobile phone, now we can be easily geolocalized. And one of the most relevant aspect about the DVI on the first days is to establish the people who were actually involved in the accident. How many people were in the area of the accident? Because unfortunately, you receive a lot of calls from families because the person is missing. And so you have the number of missing persons that are much wider than the real actual people who were involved in the accident. That's why one of the most delicate aspects is to work and establish the list of the people who are involved in an accident. This is one of the other aspects that we wanted to work on with an app. So in the end, to answer to your question, practically you may have unidentified human remains that remain, but once you have established the list of the people that were involved in the accident, it is unlikely not to find an identity of the human remains, of the fragments of the human remains, of the bodies, because at that stage, you will have a database of all DNA profiles of all human remains that you have recovered from the DVI site.
Thank you, sir. Dr. Nirmal Kumar asks, what are the important features of jaw in a decomposed body for the identification purpose?
Well, there are several features that come from the anthropological aspect. We can get information about the sex. We can obtain information about the presumed age, if the mandible belongs to an old person, to a young person, to a female, to a male. And if there are teeth, we can also obtain some information about the oral health conditions, because we can find in the bone septum between the teeth, in the alveolus, we can find a resorption of bone, which of course indicates a periodontal disease. Of course, then if we have teeth, we will have enormous number of information out of the teeth. And also we may have information once we do an X-ray of the mandible. There are papers that have worked on X-rays of mandible that can assess the sex of the mandible, not only from the anthropological visual aspect of the mandible, but also from the characteristic of the gonium as an angle. You also get information about the profile, because you may have the idea of how was the occlusion of the person.
Yes, sir. There are many more before that, sir.
This could be useful when you are starting to search for antemortem data out of portrait pictures.
Thank you, sir. So sorry I interrupted by mistake. Another doctor asks, Dr. Manu asks, can we make use of robots for the dental autopsy?
No, I would not. I don't think we would. The alternative is to do what is done for the virtual autopsy. We use a full body TC scan. So we can leave the body in the body bag. We may want to do this. If you don't want to touch, or if you don't want to, or if you are unavailable, or odontologists are not available, you may want to treat the body doing a whole body TC scan, and then out of the images you can take the slices of the skull and obtain a 3D images of the jaws and teeth, or slices like the panoramic image. I would not, in my mind, I don't have any idea of doing this kind of aspect of doing robots. I don't think there will ever be. We still need somebody. If you want to do, for example, if you want to inspect or take pictures, we still need somebody who puts the devices in the right angulation. Probably the alternative, as I said, is a full body TC scan to obtain images, but I would not think of other ways.
Sir, Dr. Rebecca asks, does the chemical composition of teeth change once the corpse is incinerated?
There is, of course, because you have the modification of the water present, let's say, in the teeth. But if the question refers to the composition of dental materials, then the composition changes, but the change is still a change that will allow the finding of the original composition, of the original formula of that material. This means that it will depend, of course, on the temperature, of course. So it will depend on temperature. I would not start an analysis of dental material or teeth to do an analysis. The incinerated teeth, the analysis I would do are the analysis you need to do, certainly not on incinerated teeth. The only, the most used, let's say, data collection on incinerated teeth, I would suggest, is the X-ray of teeth. I would not think of other analysis, except if there are any dental materials on the teeth.
So final question, sir. Do Indians have scope to work abroad as forensic personnel?
Can you explain this question to me, please?
Sir, they're asking if there are opportunities for Indians to work outside India in the field of forensic science. By Dr. Vishnu.
Well, there are. I think that there are opportunities internationally for anyone, independently if you are from India or not. I think there are opportunities in working in forensic sciences. There are positions where you have to look, of course, you have to search for positions. Recently, the International Committee of the Red Cross has put some position of forensic specialist position that are required. You may want to be looking at international organizations like the International Committee of the Red Cross, but also universities. I mean, you may find positions in universities, in teaching positions, where of course you will also have to work on cases. So the issue, I think, is to have a good curriculum, speak very good English, be trained with proper postgraduate training and look for positions which are opened. The other opportunities could be the idea of working for humanitarian organizations. There are organizations that work in the field of the missing people. There are organizations, ONGs, that work for the identification of people recovered from mass graves. There are organizations that work in the field of identification related to military operations, because there are soldiers that have died in the First and Second World War that still need to be identified. I think it's a matter of searching for these positions. I would not make it as an Indian or non-Indian. I think it's anyone can apply for positions, especially if there is behind an international organizations. Maybe maybe addressing our availability to humanitarian organization could be a starting point, maybe. This means that you have to be self-funded. This is the issue. But I think that thanks to the web, nowadays it's very, very easy to find and to search for positions. So look for International Red Cross, look for Europol, look for humanitarian organizations, especially in Latin America. There are several associations of anthropologists who are very active in this field. Another issue could be to propose a project. There are now organizations, even the American Academy of Forensic Sciences has a committee related to humanitarian forensics that support humanitarian forensics projects. So the alternative could be to create the opportunity rather than wait for the opportunity. Rather than wait for the opportunity, you create the opportunity, you offer yourself, you propose a project together with anthropologists in the field of human identification of a specific area. And you start proposing yourself and you gain maybe you gain the funds. I think in my experience, usually I prefer to create opportunities rather than wait for opportunities. But this is my attitude.
Thank you, sir. So we're done with all the questions. This is just for the participants. A recorded version of the video will be available on the university's website, www.jssuni.edu.in. And then I now invite Dr. G.B. Aravind to give his closing remarks and a vote of thanks.
A very good afternoon to everyone. We've had a very scintillating and a fantastic session on dental autopsy. And the speaker today, Professor Emilio Nuzzolese, has given his speech and lecture in 5 different areas. The first of it is dental autopsy. What is it? What is all about? The next is that when do we need it and why do we need the dental autopsy? Along with that, he also has touched upon great many precautions to be taken, particularly during the COVID-19 pandemic, and also something called as disaster victims identification. He has also touched upon an area which Dr. Nagbhushan would have recognized his paper there in that, where it was on virtual dental autopsy. So one of the papers titled by, authored by Dr. Nagbhushan also was found there. Similarly, we've also had lots of discussions in regard to human rights, and today's speaker has been very erudite about answering several questions of several nature. He's been patient enough to answer all types, including those which were a little beyond the field also today. Okay. So with this, I would like to, on behalf of the JSS Academy of Higher Education and Research, the JSS Dental College, Medical College, and myself, I'd like to thank Dr. Professor Emilio Nuzzolese profusely for your wonderful speech, sir. Thank you very much.
You're welcome.
I'd also like to thank our registrar, Dr. Manjunatha B, who's been the backbone behind most of our endeavors and who's been very kind enough to attend throughout the webinar also. He has also given us the opening remarks today, and he is still present. I see him on screen also. Thank you very much, sir, for being supportive towards all our activities. Likewise, I'd also like to thank Dr. Ravindra, the principal of JSS Dental College, for his support and active participation throughout this. Dr. Nagbhushan, Dr. Sumukh Bharadwaj for all the support. And of course, lastly but not leastly, Dr. Swati Kumareshwara, who has been the main person behind all these things. I'd also like to thank each and every one of the participants for your wonderful participation, your excellent questions also, and your listening to this also. Thank you one and all. Over to Swati, Dr. Swati Kumareshwar.
Thank you so much, sir. Thank you, Dr. Emilio. Thank you, Dr. Arvind. Thank you to our guests of honor, our registrar, Dr. B. Manjunatha, Dr. Nagbhushan for helping me as well, being part of the same department. Dr. Sumukh for taking care of the technicalities of today's session. And thank you to all the participants for being part of this. A small piece of information is all the registered participants will receive an e-certificate if you're registered, and also fill the feedback form. Thank you so much. Thank you, Dr. Emilio. Have a nice day.